Endometriosis is a fairly common chronic disease in the women of the reproductive age group. So, simply explaining, in endometriosis, the endometrial tissues get implanted in the locations outside the uterus. So, what are these locations? The most common locations involved in endometriosis includes the ovaries. So in the ovaries, they are also known as the ovarian endometrioma or the chocolate cysts. The other locations involved include the fallopian tube, the rectouterine pouch or the pouch of Douglas, the bladder, the uterine ligaments, the peritoneum, and rarely the diaphragm, the thorax, brain, skin, etc. So these were the locations commonly involved in the endometriosis. Now let's go towards the pathogenesis, which is actually unclear, but there are certain theories that have been proposed to explain the endometriosis. The first one is the retrograde menstruation theory or the regurgitation theory. So according to this theory, endometriosis occurs when the menstrual blood it backflows through the fallopian tube and gets implanted to the nearby tissues. So this was the retrograde menstruation theory. Another theory is the benign metastasis theory, which suggests that the endometrial tissue from the uterus can spread to the distant sites through the blood vessels and the lymphatics. So this was the benign metastasis theory. Another theory is the metaplastic theory, which explains that the coelomic epithelium or the cells of the peritoneum it differentiates into the endometrial tissue, which gets implanted in the different distant sites. So this theory can even explain the endometriosis that can occur in the cases of hysterectomy, which is the complete removal, surgical removal of the uterus. So this was the metaplastic theory. Now let's talk about the extrauterine stem cell theory. So according to this theory, the stem cells or the progenitor cells from the bone marrow, they differentiate into the endometrial tissue and then travel to the other parts of the body and gets implanted there. So these were four theories, four important theories that have been proposed to explain the endometriosis. Now, the endometriosis implants, they are benign and they undergo the same proliferation, same secretion, same menstruation as the normal endometrium. The only difference is that they can take high levels of enzyme aromatase, so they can produce their own estrogen. Another difference from the normal endometrium is that they can secrete pro-inflammatory factors such as the prostaglandin E2. So this feature lets them cause inflammation and scarring, and these scar can cause extensive adhesions. So this is the possible cause of subfertility or infertility that occurs in case of endometriosis. Now let's talk about the morphology of endometriosis. So, as we have already discussed, endometriosis consists of the functional endometrium that undergoes cyclic bleeding. So, they grossly appear as reddish brown nodules that range from becoming microscopic to 1 to 2 centimeter in diameter. When the ovaries are involved, as you can see in this picture, the lesions form large blood-filled cysts that in time they turn into brown colored as the blood ages. So this is also known as the chocolate cyst, and with time the blood organizes and widespread fibrosis occurs, which leads to adhesions. So this was about the morphology. This was a brief overview of the morphology of endometriosis. Now let's talk about the clinical features of endometriosis. So about 1/3 of the patients of endometriosis, they may remain asymptomatic. And if the patients show symptom, then the symptoms depend upon the site of the involvement. So if it involves the reproductive structures, the symptoms like pelvic pain, dysmenorrhea, which is painful menstruation, dyspareunia, which is painful sexual intercourse, menorrhagia, which is heavy bleeding, can occur. And if it involves the bowel, then the abdominal symptoms like abdominal pain, dyschezia, or painful defecation, obstruction can occur. And if it involves the bladder, then urgent, frequent, painful urination can occur. So these were the common clinical features of endometriosis. Now let's talk about the complications of endometriosis. So about 30 to 50% of females, or 30 to 50% of the patients of endometriosis become subfertile, which is probably due to the inflammation and scarring of the reproductive structures. Other complications include the chronic pain, and if the endometriosis involves the ovaries, then there is mutations in certain genes like P10, ARID1A, which can increase the risk for having ovarian carcinoma. So these were some common complications of endometriosis. Now, talking about the treatment, there's actually no definitive treatment for endometriosis, and the management options, they depend upon the desire to preserve the fertility. So basically, there are two therapies that can be given in the patients with endometriosis. One is the drug therapy or the medical therapy, and another is the surgical therapy. So under drug therapy, pain can be managed by using NSAIDs, and other drugs that can be given are the oral contraceptive pills for ovarian suppression, the gonadotropin releasing hormone antagonists to decrease the estrogen level, and progesterone analogs to inhibit the growth, further growth of the endometrium. So these were the drug therapies that can be given. And the other option is the surgical option. So the surgical option includes the removal of the endometrial implants, to if the patient wills to preserve the fertility, and also hysterectomy if the patient doesn't desire to preserve the fertility. So this was about the endometriosis in brief. So thank you for watching, and I will see you in another video. Thank you.